Okay, so good day once again, students. So let us continue our discussion for chapter 6. So now let's discuss the family nursing process. Okay, so one of the services or we implement, 'di ba, every now and then naman talaga is the nursing process. The assessment, the diagnosis, the planning, the intervention or implementation and evaluation. So ngayon is paano natin i-apply yung nursing process when it comes to family, no? So ito siya ay under pa rin to sa ating family health nursing. So family health nursing process is a systematic approach to help the family to develop and strengthen its capacity to meet its health needs and solve health problems. So the same lang how we deal with individualized nursing process na tinutulungan natin yung pasyente natin na gumawa ng mga plano and to strengthen their individuality and independence as a human being and making their own decisions about their health. So the same din dito sa family health nursing process, we have a systematic approach in order to help the family develop and strengthen their capacity as a family itself and as an individual family or independent family. So family health nursing, the definition daw po ng ating family health nursing. It is a nursing aspect of organized family health care services which are directed or focused on family as the unit care with health as the goal. It is thus the synthesis of nursing care and health care. It helps to develop self-care abilities of the family and promote and protect and maintain its health. Family health nursing is a generalized, well-balanced, and integrated, comprehensive, and continuous and are requiring comprehensive planning to accomplish its goal. The goals of the family health nursing include the optimal functioning for the individuals and for the family as a unit. So yun po ang definition ng family health nursing. Again, it is a nursing aspect of the organized family health care services na directed po siya sa ating pamilya as our target client or unit of care with the goal na ang ma-achieve natin is the optimum level of functioning of the individuals or family members and the family as a single unit. So family healthcare nursing is an art and a science that has evolved over last 20 years as a way of thinking about and working with families. Family nursing comprises a philosophy and a way of interacting with clients that affects how nurses collect information, intervenes with patients, advocate for patients, and approach spiritual care with families. This philosophy and practice incorporates the assumptions that health affects all members of families, that health and illness are family events, and that families influence the process and the outcome of the health care. Diba sabi ko nga kanina, I've already mentioned in my previous video na one family can affect the health status of the whole community itself because they are part of the community, they are part of the society. And if we want to improve the well-being of the community itself, we will start in improving the family, okay, the health of the families within your community. So we have here different terminologies. Again, the family is two or more individuals coming from the same or different kinship groups who are involved in a continuous living arrangement, usually residing in the same household, experiencing common emotional bonds, and sharing certain obligations toward each other and toward others. So family health is a condition including the promotion and maintenance of physical, mental, social, spiritual health for the family unit and for individual family members. So, pag sabihin natin family process, it is the ongoing interaction between the family members through which they accomplish their instrumental and expressive tasks. So, the nursing process considers the family and not the individual as the unit of care. And family-centered nursing is a nursing that considered the health of the family as a unit in addition to the health of individual family members. So, ano po yung objectives ng ating family health nursing? Ano po yung gusto nating makamit? Okay, bakit ba natin to in-implement in the first place? So, first is there are broad objectives of family health nursing. First is to identify health and nursing needs and problems of each family. So, gusto natin ma-identify yung kanilang pangangailangan, mga problema nila, baka pwede natin silang matulungan. Next is to ensure families' understanding and acceptance of these needs and problems. Kasi it's very important that this family identifies it as a problem. Kasi what if, sabihin niya sa'yo, no? Okay, ito yung nangyayari sa amin, but hindi yan problema sa amin. Okay? Yes, nahihirapan silang kumain, nahihirapan silang ganito, maghanap ng trabaho, pero sabihin nila, that's not a problem. So, you have to believe that. Kasi meaning, meron silang solusyon na dyan. So, you don't need to look for another solution kasi meron ng solusyon ang isang pamilya dyan. So, ang hinahanap natin is yung mga problema talaga na sasabihin talaga sa'yo ng patient na, okay, or the family itself na, the member of the family na ito talaga yung problema namin. Lagi kami nagkakaroon ng misunderstanding, nag-aaway kami. So, doon nagkakaroon na mag-interact ka na or mag-intervene ka na kasi sinabi na problema siya, no? Next is to plan and provide health and nursing services with the active participation of the family members. Then next is to help families develop abilities to deal with their health needs and health problems independently, to contribute to the family's performance of developmental functions and tasks. So, syempre, dapat may ambag ka. Hindi yung nakahilata ka lang sa bahay at wala kang ginagawa. So, dapat may ambag ka. Kung merong expected sa'yo na gagawin mo, ibigay mo yun. Kasi, karapatan yun ng family members mo na ma-receive nila out of you being the member of the family. So, next is to help the family make intelligent use of promotive, preventive, therapeutic, and rehabilitative health allied facilities and services in the community. So, if ever meron naman kayong available na mga RHUs, visit it. Wala namang mawawala sa inyo kung if you ever visit, no? Attend educational classes. Kasi, it may have, lalo na kung bakante naman yung oras mo, kaysa naman sa umupo ka sa bahay, why not attend educational classes or health education classes na baka makakatulong pa sa pag-improve ng knowledge mo. And then, to educate, counsel, and guide family members to cultivate good personal health habits, practice safe cultural practices, and maintain wholesome physical, psychosocial, and spiritual environment. So, paano ito magagawa? Being a role model. So, ikaw dapat ipakita mo na ikaw din ay isang mabuting anak, asawa, at nanay sa isang family setup, no? Hindi dahil ikaw ay advocator na hindi mo pinapakita sa kanila na ikaw din, no? May ginagawa ka palang mali-mali. Ang pangit-pangit naman kung ang sama-sama mong nurse, tapos kunwari sasabihin mo sa mga pasyente mo, dapat ganito ka, no? You're very plastic, no? Yeah, hypocrite ka. Okay, you're an hypocrite. So, we have here, yun yung po yung kanina, yun yung ating goals or objectives ng family health nursing. Now, we have here the different principles of family health nursing. First is to provide services without discrimination. Kahit ano pa pong klaseng family meron sila, we do not give any judgment towards this kind of family. Next is to periodic and continuous appraisal and evaluation of family health situation. Next is the proper maintenance of record and reports. It's very important that you do have your written reports regarding the condition of your family. So, meron kang logbook or charts na andun yung records per family or per household. So, provide continuous services. Health education, guidance, and supervision as an integral part of family health nursing. We have to maintain a good interpersonal relationship with the family. So, plan and provide family health nursing with active participation of the family. So, hindi lang po ikaw yung nagpaplano, ay, ito yung bagay sa kanila, ganito, ganyan. Dapat, seek approval from the family members. Kasi sila yung may problema, sila yung gagawa nung gusto mong ipapagawa. So, we have encourage family to contribute towards community health and active participation in making healthcare delivery system. So, what are the advantages of family health nursing? So, family health nursing of patients save hospital beds that can be utilized for critical cases. Syempre, kung naman ma-improve natin yung health ng isang family, nakasave na tayo ng 5, 4, 1, 2, 3 na mga buhay na hindi na pupunta sa hospital, at nakasave pa tayo ng hospital bed na pwede nating maibigay sa ibang pasyente. Kaya nga 'di ba, pag pumupunta yung pasyente, ina-assess muna siya sa ER, tinitingnan kung admittable ba yung case niya o hindi. Para naman kasi mabigyan ng way yung mga ibang pasyente na very critical yung kanilang kondisyon. Hindi dahil inayawan ka, it's just because you don't need kumbaga, intensive na care. Pwede naman na ma-manage sa bahay. Okay? So, we have also patient under family health nursing enjoys privacy and emotional support. Patients on family health nursing can continue with their routine pursuits. Yun ang maganda kasi hindi kailangan na baguhin mo kasi may sakit siya. No. At saka walang nabagong sistema sa kanila because they're in community lang. And if the patient resides in a sanitary house, family health nursing is better than the hospital nursing since he can control inimical environmental influences better. Okay, so ano po ang ating family-centered nursing approach? So meron po tayong tinatawag na family-centered nursing approach in which it has 4 approaches which included in the family nursing care. First approach is family as the context. Next is family as the client. Third is family as a system, and fourth is family as a competent of society or a competent member. Okay? Family as a component. Again, these are the 4 approaches based sa family health nursing or family health care. We have family as the context, family as the client, family as a system, and family as a component of society. Okay, so yan po yung 4. So, isa-isahin natin sila. So, family as the context. So, when the nurse views the family as a context, the primary focus is on the health and development of an individual members existing within a specific environment. So, although the nurse focuses the nursing process on the individual's health status, the nurse also assesses the extent to which the family provides the individual's basic needs. And these needs vary depending on the individual's development level and situation. Okay. Pag sabihin naman natin family as the client, the family is the foreground and individuals are in the background. The family seems as the sum of individuals. So, pag samasamahin mo yung mga members, sila ay isang family. So, the focus is concentrated on each and every individual as they affect the whole family. So, from this perspective, a nurse might ask a family member who has just become ill. Okay, so pwede tanungin, okay, ano naging impact sa'yo na nagkaroon ng sakit yung tatay mo, kapatid mo? Okay, anong impact na ngayon tumatanda na yung nanay at tatay mo? So, family as the client. And then, family as a system, the focus is the family as a client, and it is viewed as an international system in which the whole is more than the sum of its part. So, this approach focuses on the individual and family members become the target of intervention. Example, the direct interaction between the parent and the child. The system approach to the family always implies that when something happens to 1 is affected na lahat ang isang pamilya. So it's very important that to understand that although theoretical and practical distinction can be made between the family as a context and the family as a client, they are not necessarily mutually exclusive, and both are often used simultaneously, such as with the perspective of the family as a system. And now, last approach is family as a component of society. So it is seen sa iba't ibang society na many of institution in the society, along with health, education, religious or economic institution, the family is a basic or primary unit of society. So the family as a whole interacts with other institutions to receive, exchange, or give communications and services. Okay, so sa community health nursing, it has been drawn up that many of its clients from this perspective as it focuses on their interface between families and communities. Okay, so again, we deal as the members of the family as a whole unit and as the part of their society. Okay, so ano po ang ating family health nursing process? So, family health nursing process is an orderly, systematic steps to assess the health needs, plan, implement, and evaluate the health services to achieve the health. It is the systematic steps to analyze health problems and their solutions. It helps in achieving desired goals of health promotion, prevention, and control of health problems. So, it is suggested by the author of our book, si Saunders, na it consists of the following steps adopted specifically with the family as the focus group. So, ito po yung steps or elements muna. Elements of the family nursing process. It starts with assessment. Okay, so it starts with the assessments of the client's problem, diagnosis of client response, needs that nurses can deal, planning of client's care, implementation of care, and evaluation of the success. So, yan po yung elements or steps ng ating family nursing process. So, unahin muna natin the assessment of client's problem. So, the home health nurse assesses not only the healthcare demand of the client and family, but also the home and community environment. Assessment actually begins when the nurse contacts the client for initial home visit and reviews documents received from the referral agency. The goal of the initial visit is to obtain a comprehensive clinical picture of the client's needs. So dito sa assessment, dito tayo nag-head to assessment, dito tayo nag-i-interview, getting the objective and subjective data. So through your home visit, ina-assess natin yung mga iba't ibang kailangan ng ating pasyente. And then after the assessment, we will diagnose the client response that the nurse na napansin mo na okay, kailangan kong bigyan pansin to, no? So as in other care environments, the nurse identifies both actual and potential client problems. So, if you can still remember yung mga iba't ibang diagnosis sa ating during we had our health assessment, no? So, we have actual, risk, wellness, syndrome. Okay, so may iba't ibang types of diagnosis. Depende yan sa inyo. Okay, and then after the diagnosis, syempre magpa-plan na tayo ng anong ibibigay nating services based on the needs na na-identify natin during the diagnosis. So, during the planning phase, the nurse needs to encourage and permit clients to make their own health managements and decisions. An alternative may be needed to be suggested for some decisions if the nurse identifies potential harm from a chosen course of action. Okay, so dito na tayo pipili. Ano ba yung goal mo? Syempre, dito isusulat mo, ano bang goal ko dito sa pasyente, sa family na to? Ito yung goal ko. Sige, ito yung mga activities ko para ma-achieve itong goal ko. So, doon tayo yan sa planning. And then for implementation of care, syempre, i-implement mo yung plano. Hindi lang tayo basta-basta plano-plano lang at puro salita lang. Dapat may gawa. So, the nurse performs the nursing interventions including teaching, coordinating, and uses referrals and resources. So, we provide also and monitor all levels of technical, clinical problem and solutions from research and other health literature, supervises ancillary personnel. So, marami tayong ginagawa. So, depende yan sa na-plan out natin na course of activities during the planning phase. And then, after the implementation, syempre, mayroong evaluation. Wala namang saysay, okay, yung ginawa mo kung hindi mo rin i-evaluate kung naging effective ba. Hindi yung expect, okay, talaga 100% effective yung ginawa ko kasi you're not perfect. No? So, kailangan, we need to accept the fact that there's a lot of improvement, there's a lot of mistakes, at pwedeng may mga lapses yung mga, or loopholes, yung mga binigay mong interventions na kailangan ma-assess mo na pag meron kang pagkakamali or pagkukulang para ma-improve mo yung needs. Okay, ma-improve mo yung assessment na ibibigay mo, interventions na ibibigay mo sa pasyente. Okay. So, let's discuss the family health assessment. Okay, so may iba't ibang steps para gawin itong family health assessment. First thing na pinaka-importante sa lahat is establishing rapport, a good working relationship. Okay? Kailangan makuha mo yung trust ng pasyente mo kasi kung wala, hindi ka makakakuha ng access sa kanilang data. The family and the nurse maintain a working relationship. It is a relationship in which is maintained while working together by developing trust, confidentiality, and empathy. Again, empathy po, not sympathy. Ang empathy kasi is you just imagine yourself putting yourself in one's shoes of other shoes, no? Example lang, pobre yung kaibigan mo, tapos ini-imagine mo, ano kaya mafe-feel ko kung ilalagay ko yung sarili ko sa kanya. So, 'di ba? Kaysa sa sympathy kasi is kinakaawan mo siya. You do things out of pity and it's not good paminsan sa feeling ng ibang tao kasi minamaliit mo. Iba yung paminsan tingin nila minamaliit mo sila. No, a working relationship must have scope of two-way communication. So you can never build a good relationship, a good working relationship if you avoid each other or if you're not talking to each other. So, kailangan merong communication. So, after the establishing the relationship, so, meron na doon yung assessment of health needs. So, this is a continuous process. Hindi dahil nag-assess ka ngayon, tapos na, nakuha ko na lahat. Hindi. Because may iba't ibang nangyayari sa family mo na pwedeng mabago. Okay? So, family structure, characteristics and dynamics, yan yung isa sa mga ina-assess natin. We have also the socio-economic and cultural characteristics, isa din yan sa kinukuha natin. We have home and environment, the health status of each members, and also the values and practices on health promotion, maintenance, and disease prevention. So, yan yung mga iba't ibang ina-assess natin na mga health needs. So, family structure, socio-economic, cultural characteristics, we have home and environment, health status of each members, and values and practices on health promotion, maintenance, and disease prevention. For the methods of data collection, tatlong ways lang yan. Through observation, through physical examination, and through interview. So, other than that, meron pa. We have record review and laboratory or diagnostic test. So, sa observation, syempre, the use of your senses, your sight, your hearing, your smell, your touch. Syempre, hindi na ginagamit yung taste, no? Kasi hindi naman nilalasahan yung pasyente mo. And then for physical examination, ito po yung head-to-toe assessment natin. So as you can remember your health assessment, ito po yung ating physical examination. And for interview, usually po ang nakukuha nating data is subjective dito kasi kung ano man yung nakukuha na or nakukuha mo na data out of your patient itself or the family itself. And then, record review. So, syempre, ito na yung pagkuha ng mga data sa ating secondary source of data, no? So, yung mga health records nila. Hahanap tayo ng mga naisulat na previously. Okay. And also laboratory and diagnostic test. So, if ipapa-undergo natin ng iba't ibang laboratory test yung pasyente natin. But, ito siya, hindi lagi nagagamit, no? Kasi syempre, it will be pricey sa mga poor population. So, usually, doon na tayo or okay na tayo sa record review. Okay. So, now let's discuss naman the assessment of health problems. So, paano ba tayo maka-identify ng problema? Okay. So, we have different problems, no? Tatlo. It's either health deficit, health threat, or foreseeable crisis. So, masasabi natin na ang family problem is a health deficit pag meaning is health deficit is referred to the instances of failure in health maintenance and development. So, this includes na-diagnose or nagkasakit yung family member, sudden or premature or ultimate death due to illness or due to disability or nasagasaan, that's health deficit, deviations in growth and development, and personality disorder. May sayad sa utak, okay, nasiraan ng bait. So, meaning lang ba, 'di ba, from the word deficit, kulang. Okay? Nakulangan. Kung example lang natin yung health, 'di ba yung health is a complete mental, physical, social, spiritual. So what if sira ang kanyang cognitive, okay? Sira ang kanyang intellectual, mental well-being. So syempre automatic na yan siya, meron siyang health deficit. Pag sabihin naman nating health threat, okay? From the word threat, hindi pa po nangyayari sa pasyente, pero maaring mangyari to kasi meron ka nang nakikitang risk factor sa pasyente. Health threats refers to the conditions which predispose to disease, accident, poor or retarded growth and development and personality disorder or a failure to realize one's health potential. So example lang natin, nakatira ka sa tabi ng basurahan. Nakatira ka sa isang household na wala ni isa sa inyo ang nabakunahan ng COVID-19 vaccine. Nakatira ka sa laging tinatamaan ng tsunami. Nakatira ka or kasama ka or you belong to a family na hirap or poor, very poor. Okay, you have health history or family health history ng mga iba't ibang sakit and so on, no? So health threat, okay, may mga risk factors na pwedeng mag-cause ng disease sa iyo, no? Wala ka pang sakit ha, risk pa lang. And then pag sabihin natin foreseeable crisis or foreseeable stress or what we call stress points, sila po ay mga situations which refers to anticipated periods of unusual demands on the individual or the family in terms of adjustments of family resources. So foreseeable crisis is about the anticipated na mga periods in which nagkakaroon ng unusual demands kasi nagkaroon ng changes sa family structure such as nabuntis yung nanay, nabuntis yung anak, nag-aral yung anak, namatay yung anak, namatay yung tatay, nagka-retire, nawala sa trabaho. Yan yung mga unexpected na it will bring a lot of stress sa family at nagkakaroon ng problem with the adjustments of the family. So, though these conditions are expected, but still, they lead to various types of crisis in the family. Siyempre, kahit expected naman natin talaga na mawala ng trabaho at one point. Kasi hindi naman a lifetime ang trabaho. I-expect natin din na mamatay yung isang tao sa atin because we don't have forever, no? Expected natin na pwedeng mabuntis, pwedeng maikasal, pwedeng mag-aral, di ba? So, yung mga ganun is a stress points kasi nagkakaroon ng problem with the adjustments of the family. Okay? So, assessment of families may include assessment of environmental condition, health status assessment, family health practices, and the family lifestyle. So, pag sabihin natin assessment of environmental conditions, so syempre from the word environmental. So, ina-examine po natin yung uri ng bahay, hygienic conditions. Tinatanong natin dito kung um, ano to, may CR ba sila, naglilinis ba sila, tinatapon ba nila yung basurahan nila sa tamang paglalagyan. Okay, so yung mga ganun, no? So, if you had already printed your checklist sa community, makikita nyo doon yung community assessment form. So, doon yung makikita talaga ano yung mga iba't ibang ini-interview natin or ina-assess natin or ginagather natin na data. So, for health status assessment, so this is the physical and emotional health status. This must be done for all family members by using the available assessment tools. So, each family member should be evaluated even if he or she is not a primary person whom you are seeing. So, ano yung mga ina-assess natin dito? Syempre, the demographic data, health, age, sex, weight, immunization, developmental health history, so on and so forth. Okay? For family health practices, syempre, yung mga kinagawian ng isang pamilya when it comes to health. Okay? Such as yung kanilang sleeping pattern, nutritional status, exercise, rest, kung meron bang nag-alcohol sa kanila, nagsusmoke, use of health facilities. For family lifestyle, syempre, ito na po yung to observe and describe the family's interrelationship and communication pattern. So, we try to identify the role of each family members, the patterns and the decision making, no, towards towards the healthcare, and then assessment on family health, assessment of health risk families. So, health risk families are those who experience a particular event or other events of any disease repeatedly that can make them more prone towards physical, psychological, and environmental response. So, assessment through family is kukuha tayo ng this is just a review, no? Health records through clinics, through our observation and physical health assessment. So, here are the initial database for family nursing practice. So, first database or first data is the family structure, characteristics, and dynamics. So, dito, tinatanong natin yung mga members of the family at saka yung mga relationship nila towards the head of the family and other members of the family, their demographic data, their place of residence of each member. Syempre, pwedeng yung iba nakatira sa ibang lugar na, the type of family structure, kung patriarchal ba. Pag sabihin natin patriarchal, ang nasusunod is yung tatay, matriarchal, ang nasusunod is yung nanay. Nuclear or extended or even different types, yung nasabi natin, na-mention na natin previously, yung mga iba't ibang types of family. We have also dominant family members in terms of decision making. So, example lang, in absence of the parents. So, sino yung gumagawa ng decision sa isang pamilya. And then the general family relationships and the dynamics. Okay, the presence of any obvious conflict between family members. Okay? Then, next, another data na kasama po sa initial database natin is the socioeconomic and cultural characteristics. So, kasama dito yung income and expenses, educational attainment ng mga family members, ethnic background and religious affiliation. Kasi pwede talaga na yung isang pamilya na iba-iba yung religion affiliation nila. Merong Christian, Roman Catholic, born again, may Muslim, may Islam, merong Buddhist, depende yan, no? So, we don't judge. Okay, we have ethnic background and religious affiliation, the significant others roles they play in their family's life and the relationship of the family to our larger community, and the extent of participation of the family in the community activities. So, another data na ginagather din natin during assessment is your home environment. So, kasama dito yung housing. So, yung space ng bahay, yung sleeping environment nyo ba, may kwarto ba, ilan yung kwarto, gaano kalaki, may CR ba per kwarto. So, yung mga ganong, nakatira ka ba sa malapit sa maraming action hazards or accident hazards, yung food storage niyo, yung tubig niyo, kung meron bang naiinom, ganyan-ganyan. And then, the toileting. So, we have the kind kind of neighborhood. Okay, so if ever nakatira ka sa the slums of Tondo, okay, congested ba or hindi, social and health facilities available, and communication and transportation facilities. Next, another data is the health status of each family member. So, dito yung medical nursing history indicating the current and past significant illness of the family members. The nutritional assessment. So, ang kinukuha natin dito is yung anthropometric data. So, minimeasure natin, lalo na yung mga bata, minimeasure ba natin if meron silang, may mga malnourished sila na mga bata, okay? Dietary history, yung mga diets nila ba, meron sa bahay is pescatarian, vegetarian, okay? So, we have eating or feeding habits or practices. We have also assessment of infant, toddlers, and preschoolers. Okay. So, developmental assessment. Okay, pwede natin gamitin yung Metro Manila Developmental Screening. We have risk factor assessment indicating the presence of major and contributing modifiable risk factors. The physical assessment, which indicates the presence of illness of any individuals, which may be undiagnosed or untreated. And the results of laboratory and other screening procedures supportive of the assessment findings. And another database is your values, habits, practices on health promotion, maintenance, and disease prevention. So, example lang, yung immunization status, healthy lifestyle practices, such as yung rest-sleep pattern nila, the exercise pattern, the nutritional and metabolic pattern, okay, mga use of protective measures, the relaxation and other stress management activities. We have also use of health promotive health services. Okay, so now for the planning, okay, sa planning po ng nursing action, we have different steps, no? First step is to have a goal setting and selection of appropriate strategy. So, syempre, hindi lang tayo basta-basta nagpa-plan. So, unang-una sa lahat is we want to know what is our goal. Okay? Pag hindi kasi natin alam yung goal natin, walang direction or walang pupuntahan yung gusto nating mangyari. So, we set goal na specific, measurable, attainable, realistic, time-bounded. Okay? Sila yung SMART. Okay? The mnemonics SMART. So, a good assessment will make the selection of appropriate goals and strategies easier. So, families determine the degree of change required. So, still pa rin, pag magpa-plan out tayo, we assess the needs of the patient and ipapakita natin sa kanya, okay, ito yung plano ko, okay, swak ba to sa'yo? May gusto ka bang baguhin? May ayaw ka bang gawin dito? So, yan. After the goal setting, syempre, you will have your formulation of the nursing diagnosis. So, bakit kailangan nating ma-identify yung nursing diagnosis? Para alam natin, okay, ano yung mga iba't ibang intervention. Syempre, no, what if ang problem nila is, in pain yung patient, in pain yung isa sa kanila. Now, ang ibibigay mo na services is yung para maibsan ang ubo. Kailangan ba nila yun? Hindi. So, kailangan ma-diagnose natin. And then, resources available. So, we need to identify ano ba yung mga pwede nating mga services or resources na pwedeng maibigay sa kanila. Kung hindi kaya yung ganito, maghanap tayo ng iba, no? Hindi dapat based on tayo, ay, ito talaga, ito yung kailangan. So, ganito, no? Kasi mahirap din sa side ng tayong mga nurses kasi limited nga din yung resources na meron tayo sa community. And then for implementing the program, so implementation of nursing process in the family healthcare is the foundation of nursing practice. So walang saysa yung pag-assess ninyo, pag-diagnose ninyo, pag-plan out ninyo if hindi nyo i-implement yung na-identify ninyo na mga solutions. Walang sense or walang changes na mangyayari if walang implementation of care. And then lastly is the evaluation of the program action. So, it is a never-ending process kasi every now and then we assess and evaluate if the services that we give to the family itself is very effective at merong saysay, no? Hindi naman maganda na walang effect sa ganito tapos still ongoing ka pa rin na ginagawa mo kasi walang mangyayaring improvement if stagnant ka lang at hindi ka mag-evaluate ng pagkukulang mo at saka yung mga tama mo. Okay? So, the nursing care plan, may tinatawag tayong nursing care plan din. Syempre dito is ang tawag is family care plan. So, family care plan is the blueprint of the care that the nurse designs to systematically minimize or eliminate the identified health and family nursing problems through explicitly formulated outcomes of care. So, katulad lang din yung paggawa ninyo ng nursing care plan which mag-start sa cues, nursing diagnosis, the goals, objectives, the interventions, the rationale, and evaluation. Ganun din po yung gagawin ninyo sa family health nursing care plan. Okay, so qualities of a nursing care plan. First, it should be based on clear and explicit definition of the problem. And a good nursing plan is based on a comprehensive analysis of the problem situation. A good plan is realistic. The nursing care plan is prepared jointly with the family. The nurse involves the family in determining the health needs and problems. So, in establishing priorities, kailangan ando doon ang family. And then, the importance of planning care. Bakit daw importante ang pagpaplano? Because they individualize care to clients. They help in setting priorities and providing information about the client. So, we promote systematic communication among those involved in the healthcare. Okay? The continuity of care is facilitated through the use of nursing care plan. That's why, diba, gumagawa tayo ng FDAR or nurses documentation kasi still pa rin adopted siya out of your nursing care plan. So, the continuity of care is ando doon kasi meron tayong evidence na, okay, ito yung binigay kong services sa kanila at ito yung next na course of action ko. So, nagkakaroon ng continuation ng care. And then, nursing care plans facilitate the coordination of care by making known to other members of the health team what the nurse is doing. Okay. So, steps in developing nursing care plan. First is to the prioritization of the problem. So, it should be based on the nature of condition or problem, modifiability, preventive potentials, and salience. Okay. So, the nursing care plan have goals and objectives. So, expected outcomes, conditions to be observed to show problem is prevented, controlled, resolved, or eliminated. The client responses or behavior, and the specific measurable client-centered statements and competency. So, yun po yung mga iba't ibang goals ng ating nursing care plan. So, the plan of intervention are decided on based what? So, these are the basis, no? So, measures to help the family eliminate the barriers to performance of health tasks, the underlying causes of non-performance of health tasks, family-centered alternatives, okay, to determine the methods of nurse-family contact, and to specify resources need. So, the plan for evaluating is kailangan kasama pa rin din siya sa criteria and outcome based on objectives of care, and also isasali na din sa pagpaplan natin ano yung gagamitin nating evaluation tool para ma-assess natin if tama yung ginagawa natin. Okay, so let's go with the roles of family nursing. The roles of family healthcare, the roles of healthcare nurses are evolving along with the specialty. So each healthcare settings affects roles that nurses assume with families, and many of these roles may occur in the same setting. So ano yung mga roles po ng ating family nurse or family health nurse? So first is health teacher. So ikaw po ay tinuturuan mo yung family about wellness. Next, you act as a coordinator, collaborator, and a liaison. Kasi you coordinate with the family members the care, no? They receive and you collaborate with them. The next is ikaw ay deliverer and supervisor of care and technical expert. So the nurse either delivers or supervises the care that families receive in various settings. You act also as a family advocate. So the family nurse advocates for families with whom they work, especially doon sa mga poor talaga na families. So next, you act as a consultant. Okay? So, you serve as a consultant whenever asked or as necessary. Okay, tatanungin ka, tama ba yung ginagawa ko? Ganito, ganyan. So, they seek consult from you. Okay? You act as a counselor kasi binibigyan mo sila ng, therapeutic communication. You have this kind of therapeutic role na tinutulungan mo sila na mabigyan sila ng idea and makagawa sila ng sound and good judgment. You also act as a case finder and epidemiologist kasi hinahanap mo ano yung mga families na merong sakit. Okay, nakakahawa ba to siya? So these are really nangyayari lang ba to or one time big time lang nangyayari sa community na to? So yun. You act also as environmental modifier, a clarifier and interpreter. Okay, in times na may kailangan yung family and then hindi nila masabi, ikaw, no? You clarify and interpret data and you act as a surrogate. So, the family nurse serves as a surrogate by substituting another person. For example, the nurse may stand in temporarily as a loving parent to an adolescent who is giving birth to a child. So, di ba? Hindi naman lagi kasama sa panganganak yung magulang. So, ikaw yung andoon, support, no? You are a surrogate. You're in exchange sa mga absences ng ibang kan. So, you also act as a researcher, a role model, a case manager. So, a case manager, sila po ay ang gawain po nila is the coordination and collaboration between family and the healthcare system. So, this has been formally empowered to be in charge of a case. So, example lang natin, identify na ang family dito is ganito. So, it's a case of abusive na asawa. So, ikaw yung magiging case manager. Okay? So, sample for family nursing diagnosis. Ayan siya. Pwede niyo siyang check out dyan or pwede nyo hanapin sa internet, no? Na ano na yung mga iba't ibang samples ng good family nursing diagnosis. So, I will end my discussion here. So, alhamdulillah, I am done discussing the chapter 6. So, you may watch the part 1 and this part 2 para maintindihan yung overall na discussion sa ating chapter 6, the family health nursing. So thank you for watching and have a nice day.